Okay, hello everyone. I'm Mark Storella, professor of the practice at the Pardee School of Global Studies and director of the African Studies Center here at Boston University. What about health? Where is China's role in health going, and where did it come from? If we analyze this question, what we'll see is that there have been three distinct phases, and I'm going to walk you through them, and we're going to try to predict the future. Let's start with the beginning. In 1971, China joined the United Nations and joined the World Health Organization. That was the first time China had an opportunity to play a big role in global health, and it started small, low profile. Take a look at its contributions financially to the World Health Organization, which take off during the time of COVID. It looks rather impressive, but then you compare it with the United States, and you see that China's contributions financially and in terms of policy have been tiny. When I was ambassador to Zambia, I tried to engage my opposite number, the Chinese ambassador, to see if we could find ways to cooperate together on health in China. Frankly, he said no. And instead, China pursued its own bilateral projects that were high profile and focused on reputational issues for China. My conclusion was that in this early phase, which went on until about 2002, China was focused on strategic investments and limited amounts of resources. It was not focused on multilateral engagement. Then everything changed. And it changed because of SARS. In 2002, November, SARS broke out in Yunnan province. It wasn't until April of 2003 that China permitted the WHO to visit and investigate what was going on. China tried to keep wraps on it. It did not report what was going on. It was ashamed, and there were reasons it was ashamed. The impact of SARS was tiny, only 961 deaths, but between 30 and $50 billion in economic damage. But China switched. The premier took over leadership of this issue. China decided to put forward a candidate for Director General of the World Health Organization, Margaret Chan, Director General from 2006 until 2017, and China engaged the world on research and development in the health field. They started their own Centers for Disease Control with the direct cooperation of the United States. Things really seem to be changing. Now we enter the difficult period of COVID. COVID happened at probably the worst time it could have happened, a period of disruption in international relations and a period of direct conflict between the United States and China, at least on a rhetorical plane. China initially was more forthcoming with information, but when it was pressed and investigations were conducted by the World Health Organization, initially they limited an inspection and then they blocked future inspections into the origins of the virus. At that time, the conflict between the United States and China became rancorous, each throwing insults one at the other. Wuhan virus, the US military is behind COVID. Frankly, it was kind of a disaster. China moved to vaccine diplomacy, relied more on bilateral relationships than multilateral relationships. And when it dropped to zero COVID, it again did not report what was going on and still is not reporting what's going on. What's the future got to say? Well, I think that we'll find that China has to answer several questions for itself, and that will determine whether or the nature of its engagement with the international regime. First, is it going to be multilateral or bilateral? And is that the wrong question? Is China simply going to be both? We can track that in part by where the money goes, whether it's in bilateral investment or multilateral. Second, will they prefer transparency over sovereignty? This is going to play out in several different areas, including current negotiations over the future health regulations that are being negotiated in Geneva right now. Third, will China be prepared to engage in collaboration with other great powers like the United States, or will it see these opportunities more as competition that should not be engaged into mutual benefit? And finally, what can we study about China's culture and governance that will explain at a deeper level how China approaches its global health engagement? This is not an obvious question, and I don't actually think I know the answer. However, I will say that the future of global health will depend on which direction China goes on all four of these issues. Watch this space.